masks, 55 in masks, 225,000 face shields, 4.2 million gloves, and 100,000. And we have more on the way, more particularly 5 masks. So I want to thank Jared for all he's done to get the key supplies. And we here's here what they're doing in terms of like if you're in the grocery store wearing some type of face, I think that's really smart. The grocery stores are packed, and when you have close contact, this virus is be transmitted. Having the mask, I cut down transmissibility. I think caution. So we're going to work to be able to more masks, and very, very appropriate. Conventions. We've been working with the Army Corps of Engineers over the last several weeks. As many of you know, when this launch was to stop the spread and other initiatives that were done in South Florida and state flattening the cope, with who were impacted by this illness. And so from the very beginning, we looked strategically around the state and made plans to be able to expand capacity. And so that's one of the things that we're going to be doing here today. This facility, in conjunction with engineers, will open with 450 ICU beds for a total of 40 beds. But it will cover 500,000. You will be able to scale up to 1,000 if the need is there. In addition to contract staff of doctors, nurses, assistants, respiratory therapists, and other personnel, the facility will be staffed by 184 members of Florida's National Guard medical team as follows: 10 physicians, 19 physician assistants, 5 case managers, workers, 25 medical clerks, 25 patient transporter, 20 EMT technicians, 2 assistants, 50, 16 registered nurses, and 1 licensed preventionist. Will provide a lot of resources should the need arise to be able to care for patients. And this is going to be a facility that will accept COVID patients. Some of the overflow that's been done in the country, and it for non. This is for COVID, so if somebody has it, this facility is able to accommodate that. And I think that that's something very, so this partnership with the Corps, we think is very important. We thank them. Of course, we work with them on things like HOB anyways, but I want to thank them, General Semonite, for his leadership and for them really stepping up to the plate. This is one part of have additional capacity. In addition to the beds here in the convention center, 200 Pan American Hospital, 250 beds at a field hospital right here, and those will be that are manned with that the state of Florida with, so you're not going to have to deplete resources for systems here in Miami. It's just supplementing what's already taking already there. Outside of it, we have an additional field hospitals as the need may be. We have one that's ready, another stood up very quick beach, and then we're also looking at the west coast of Florida and potentially northeast Florida. But we have ready to be deployed for hospital and the ICU beds. 151 nurses, 15 nurse practitioners, and 14 doctors. They're under contract. They're standing by, ready to deploy. So that is their worst, and the worst not than not there. And so what you're seeing here today, the Army Corps, Miami-Dade County, Miami Beach, all we can to be fully prepared. And again, these plans have been some. Finally, just in terms of hospital in Florida, right now the availability statewide is 43%. Miami-Dade is 43%. Broward is almost 40%. Palm Beach 49%. Hillsborough 41%. Orange 100%. So we have capacity at the hospitals. We don't know, what a surge may bring, but we have to that so that we're able to take care of people. So it's the smart thing to do. I think it's the responsible thing to do. And, I'm really glad to have the Army Corps of Engineers with us. And so I'd like to be able to introduce Lieutenant General Todd Semonite. I want to thank you for your friendship and for your leadership.
Well, listen, Governor, to you and the other senior leaders here, I can't think of a better team to be able to be partnered up with, to be able to support such an important thing. You mentioned a little bit about the Corps of Engineers. We've been working in Florida for almost 100 years. Disaster response, Everglades restoration, beach renourishment. But I can't think of a more noble task than saving Floridians that have been infected by this virus. And just the thoughts and prayers of all of us in the Corps and in the federal government go out to all of those people, and especially the real heroes, the front lines, the nurses and the doctors. And this ability to bring this facility on to be able to help mitigate this is going to be instrumental. And this really is a team effort. Today, the Corps of Engineers is working for that man right there, the governor, okay? And we're going to work side by side with the mayors, with the city leadership, the state leadership, the national the medical communities. We are here basically on behalf of FEMA to be able to help out, but let there be no doubt as to where our loyalty is. When the governor decides how they want to do this and what their plan is, we need to be able to put this in the ground to be able to make sure that we're meeting that requirement. We developed about 3 weeks ago what I would call standardized. We went to all the experts and we said, what are the medical requirements? How do we do this to code? How do we do this? Is it COVID, non-COVID? Do we do it in a convention center? What's negative pressure? And over the last 3 weeks, we are in the process right now building 17 different facilities, about 15,000 beds that we're putting in the ground right now. Here's the message. Just finished New York, just finished Detroit, and just finished Chicago. And Governor, we learned a lot of things by building facilities. So this facility that we're building out, we've migrated a lot of those lessons learned. What's the best way to run a nurse's station? How do you do patient discharge? How do you work all these things? And we've integrated those back in and be able to make sure we're leaning forward. The governor talked about 400 and then the 50 ICUs, but there's a lot of other supporting requirements. What do you do for showers? There's not a lot of showers in the convention center, so how do we bring those back? What do we do for oxygen? How do you be able to run patient receiving and then patient discharge? PPE transition. Every time a nurse take a break, how do you make sure they're going through the right protected areas? Drop that. Those things go away so they aren't hurting anything else. And that's what is going to be able to provide. Is that we're very excited to work with this great team. Jared, you and your crew have been phenomenal already. And there's a colonel over there, right there, Colonel Drew Kelly, who works for me. He's in the district. That colonel and everybody in Jacksonville is 100% focused. And we got a lot of tasks right now, but that getting this done. This is a hard build. This is probably a 3-week build. Have 3 weeks. He just sat with me and said, night of the 20th. So this it and build it as you'd like. It's suspense. And put them in the way. Everybody focused on that particular obstacle, whether it's local, state, city officials to try to figure out how do I work our way through this? How do we mitigate this? How do we get a solution that is not the perfect solution, but it sure is the mission essential solution, so we make sure that when the first patient needs to show up, there's a bed that's able to do it. So Governor, the mayor's here, you have my commitment, and everybody in the Corps of Engineers and Jacksonville only. We will fly whatever we need to from the United States all around our whole domain in here to be able to get this done, because I think where the is you've got the and you've got the plan. We're just proud to be part of you. I think with that, I'm going to pass over to my.
Thank you, General. And Governor, thank you for all the support you've given us here in Miami-Dade County. And this is a great example of the cooperation of federal, state, county, municipal governments. What's in here is a 150-bed facility, temporary hospital that we hope never to use. We have to have it just in case that we do for our. Again, I can't stress enough you, Governor DeSantis, for all the support you've given us here in Miami-Dade County. Again, I can't again for what, and Mayor Gelber, thank you for allowing us to use. The state called us, said, or the court called us, we have a square foot facility somewhere in Miami-Dade County. Yeah, we do actually, but there's only one 500,000 square foot facility that we know of, and that's in the city of Miami Beach, and that's the convention center. And thank you. This again, this is a facility we hope never to use. We don't know. There's a surge supposedly it's coming. As the governor said, we have plenty of capacity right now in Miami-Dade County. We have plenty of hospital beds, ICU beds. We have plenty of ventilators for what we think is going to come. And but again, if something above comes happens, then the facility will be the additional at Panama or a great. And there's another 250 beds at the Miami that's already up and running that could be used for the same purpose. So we have capacity, but thank you and a great cooperation between the federal and local governments on. I'm going to say words in Spanish. So you're saying Spanish, por favor. Okay. Estamos aquí en una construcción de un hospital temporal en el centro de Miami Beach. El hospital va a estar construido por el cuerpo de ingeniería del cuerpo del ejército de los Estados Unidos. Le tengo que dar gracias al gobernador DeSantis por todo lo que ha hecho aquí por nosotros en el condado de Miami-Dade. También el Todd Semonite, que es el general que está en cargo de la construcción de este hospital, y el alcalde Dan Gelber de la ciudad de hospital. Este va cuarto que COVID-19 que tenemos que usar este hospital. Tenemos suficiente capacidad ahora en el condado más de 3,000 cuartos vacantes, más de 300 cuartos de intensidad, ayuda a intensidad intensa, también 300 aquí en el condado de Miami-Dade que no se están utilizando. Hemos visto de aumento en los casos que no ha pero si algo de lo que estamos esto aquí para ayudar a los residentes de Miami. El gobernador está construyendo en el hospital Panamá. También tenemos otro hospital temporal que está en lo de Miami. Hay 250 cuartos ahí, así que algo que no esperamos que vamos a necesitar para usar, pero si algo sucede, está aquí, ya estamos. Así que otra vez la gracia al gobernador Ron DeSantis por su ayuda, al general y también el alcalde de la ciudad de Miami, Dan Gelber, por toda la ayuda que nos ha dado para hacer este hospital. Si se necesita más capacidad, también puede aumentar así que 450, así que eso es buena noticia también. Now I'm going to turn it over to the chair of the city of my good friend.
Thank you. Gracias. First, I want to acknowledge every morning my commission meets on the phone with our city manager. Some of them are here today. Commissioner Samuelin, Commissioner Gangora, Commissioner Richardson. On the phone is County Commissioner Higgins is on with us, talking to our city manager. Multiple it feels like calling or texting with Mayor Gimenez as he's asking what we and to talk about some of these issues. Even regularly hear Governor calls just to what we need. So reaching out, thank you for putting this together. And it's just like these masks. You wear them, and when everybody wears them, is in health. A city in America not built for social. You are in it. We want people to dance at their weddings, to embrace on their honeymoons, to visit our beaches, our promenades like Lincoln Drive, our park. We want them to and our and we want them to come here to this convention center, the biggest art show in the world, walk around together, experience fantastic Super Bowl experience where families and friends sit around for their favorite team. But things are different right now. Things are much different, and we have to be all that. We have to be great at this. Our city, every CDC guideline, each time it's came out, it's as an emergency order. Lean into this, and that's why we're frankly part of this with you. And we know you're going to take over. It wasn't really a question. Obviously, you need to do it. We find it forceful. We're going to convert a convention center into a hospital in weeks. That's something quite amazing. But frankly, it's for the entire community, including ours. We find a way. This is the way we would have had our this week. Tens would be on Ocean Drive in a. Find to express who we are. So I want you to know we are grateful to have this and purpose. And we hope that this isn't going to be used. We pray that it's not used, but God is still playing. And so we pray for the worst, and we're praying for the best. And we couldn't be ready if all of us weren't working together and our residents weren't accepting the fact that this is something real and they need to do all of these countermeasures and all actions we're doing. So I appreciate everybody who's here, but I mostly appreciate the residents who have decided that this is important enough for them to change what they do every single day, that a neighbor don't know.
Yeah, so we don't want the line. I mean, so social distancing is important. Some people don't have access online. Obviously, the web problems, servers in. Sunday, I think, then it started working on that, continue to do it. But for people access to the internet or just are having a tough time to be optional, the folks in high hand it out in the car, or to just do it in a way that's not going to create crowds. I mean, right now, we have a respiratory virus that is when you have close, usually sustained contact with somebody, and if you refrain from that and orders state, and I know the mayor here has had this for a while, I mean, is to minimize contact at the household, and so that's what you got to do. So I know that they're going to try to do some with where they hand them out to people. Cars. We have a deal with FedEx. FedEx is going to can grab them, mail them back later that day. So we have an option. I have 2,000 employees identified, who aren't a part of these other agencies. We're surging in. So as these applications come in, they got to process. So we're forth an effort we've never really done on a thing like this in the state of Florida before. But I think it's important because of the shock that so many people felt. Things were going along great. I remember when this, when all this really getting heavy in March, the unemployment was 2.8%. I remember looking at the report thinking like, man, days, and that was going to change. So you have so many people that had jobs through no fault of their furloughed. Some have already been fired. There's other places where maybe they pay you for a little bit, but some of them aren't going to keep doing that. So I think it's important for folks to be able to have access to that. So, but don't violate distancing. I mean, that's just what this is. Stick to the here. You're going to come back to work much quicker on the back end.
Governor, wait, if I could, I need to clarify something on that question. Miami-Dade opened up 26 libraries today in order to do exactly what they did in but I've been working with the state governor, with the governor and the state of Florida on opening these sites. And so our sites are a lot different. There's everybody do distancing, and so you'll see a lot different operation from Miami-Dade County.
So, I mean, the law is when you can file, but what I've told Ken Lawson is, you know, if someone was trying to apply on like last Wednesday and it wasn't working, then I think you should count that as the day. So he's looking at, you know, how that will work. But I mean, I think that reasonable if the system, you know, because when this all happened, DEO, you know, there's going to be a surge. Hire more people in the call center, do all that. They'll do it, but just easier for them. So they were telling people to go to this thing, and then it reached capacity. And so that is something that I don't think is their fault.
What are the levels for the county? The governor, facial coverings, Miami Beach is doing it. Why hasn't supermarkets and restaurants done the same thing?
It's something we're going to be discussing today at my staff meeting, and there are from some of our attorneys on issuing. So I got to get to the bottom of it, and if we can resolve it, then issuing that kind of an order. I've seen a lot of compliance with our recommendation that everybody wear facial covering when they're inside some kind of a confined space.
Governor, question for what is the targeting the field hospital here, Governor?
Hospital in Miami's up.
Yeah.
And so that, yeah, and then this well, and you know, normally that's a schedule, but I think, you know, and then they'll probably it. So, and this is all based off, look, all being revised about when this or when that. I mean, so what we basically said is we're going to plan for kind of the worst case, but I mean, how the cases have been going and the new options, clearly there's so absent a major capacity, we don't know what kind of change will be. We don't know, so that's why they're doing it. So that'll be there, and that basically sides with people think some of these things may hit different things, but I just think and that's what this will do. Employment benefits, as you know, is set by law. You know, what I told is, you know, we need. I want people that are applying to get there as soon as possible, because these federal benefits are here tomorrow. The way it is, the feds are working hard to be able to get this money. I know I've been working with Rubio on these small business loans, gotten that out, and even complications to it for government work. I mean, it's amazing that they've been able to get that many out. So, you know, I've said get the money out, do what you do at the state level. We really want to help and prod the Fed get their share. The Fed share obviously is going to be more significant than what we currently have in Florida law. But whatever we have in Florida law, you know, we obviously want to be able to get.
Porque hay alguna preocupación sobre de los abogados del condado. Me han dicho que están preocupados por un tipo de orden. Yo no sé todavía, por eso tenemos reunión. Preocupación también. ¿Hay suficientes máscaras o no hay suficientes máscaras? Así que si tú das una orden, tienes que dar una orden que cumplir. Y sabemos que hay muchas máscaras que es demasiado, no hay suficiente para todas las cosas que deseamos.
Let me just before I'll take it, but let me just make a point, because we were talking with and I've been talking with other folks throughout the state and actually people in the White House. Okay, yeah, obviously we've got to get through this, but we'd be foolish not to plan and say what does it look like, you know, once we think that the cases are declining in terms of we interact and how the economy works. And it's that standing here today, we have a huge array of options compared to where we were just 3 or 4. For example, you go back 4 weeks, I mean, it was hard to find even a swab to test somebody for this. Now we have this 5-minute test that's available. And so you look at how Florida, I mean, we've had some of the areas that have been spots, I think, have been connected to cruise ships. People coming from from the world all the time. I would like to see these rapid tests integrated with some of the international travel. If you're coming from like a Brazil or coming from these other, good to have that's available, so that as people come to Florida, we know that people aren't necessarily carrying the virus. I mean, we're going through a lot. Miami's gone here. Other parts of Florida out here. We've had a lot of dislocation economically. We're trying to mitigate that, and we're going to try to bounce back from it. But, to go through all that and then just have people coming internationally or even domestically and seeding it all over again, I think is a problem. And so I think we need to be talk to the president about this about some of the, because the fact of the matter is, air are what brought the virus to the United States. And so we got to think smart about it. I think we want to have people be able to function as a society, but I think there's ways that we can now do that much smarter. But the travel, I think, is something we're going to have to build in some protections for. We do. First of all, if you look at the report that the State Department of Health puts out, I challenge you to find another state that's even close with transparency. We have we have a dashboard that in real time as the cases. Some of these others, when our numbers come in, those are fresh. Other states, those are 4 years old and fresh. We now have it broken out. You have age. You have the cases. Any nursing home or assisted living facility by. We now have had questions in terms of ethnicity. So we're now out race or ethnicity. Don't have it for every patient. We do. We're putting it there, and then we're University of Florida, and we're supporting with our kind of an investigation in public housing communities, primarily American, to figure out underserved where they may be not getting what they need. Now we have drive centers as open for everyone, but maybe the message hasn't. So we're looking at that. We're doing some other random testing to try to figure out how many people are asymptomatic that may have it. So we're doing a lot. All that in every daily report, the number of people or somebody who lives in assisted living, listed by county, the number. It's also important to keep in mind, a nursing home is going to be a different from the independent living. It's like people can, and we've tried to do restrictions there, but actually, people are going to be able to make, the nursing home, you have an ability to control. And as I mentioned with the Abbott Labs test, I've told the Department of Health, I harness that ability to test quickly, checks and facilities. They're working on that, but I told them to deploy that as soon as possible.
As far as protected peers, there is a projection for Miami-Dade County because you do that our hospital needs, our hospital capacity will be exceeded. What are the you have seen?
This is not about. So what I've seen, because we keep is that exponential. This is not growing exponentially linearly. So unless there is some exponential that I have, all right, then the capacity that we have should be sufficient. But some models show an exponential growth. We have to be exponential growth. What I've seen now is a linear, and I haven't seen a steep linear growth. I've seen gradual linear growth in the number of cases. There are people leaving that had COVID-19 and they're coming in. The difference, that delta, isn't a large number. It isn't like this. The growth, something which is alarming at this point. That could change tomorrow.
And what I would say too, if you look, we have testing more here than there are states that have more positive test results, and we have like 3 times as many of negative than they do. So we're just doing a pool. Them have, you look at Indiana, some of them, they just haven't tested overall positives and way fewer. Now we do. You hear someone will report somebody saying the model says this. We look at every day, throughout the day as it's coming. Just day over in the state of Florida, the number of hospitalizations for COVID-19 was net at 44, Miami-Dade negative 30, Broward, Palm Beach. When we're looking at that, seeing how that is changing, positive cases are important, but there's a lot of people tested who are not in the real danger age. People who are under 55, a lot of them don't have health problems. Those are people, they're positive, they isolate. A lot of them are fine. Some in the country, it's more not only important here, hospital under control, so which direction state of Florida. So just a big diverse state. I mean, if you look at the case, percent are in just the 3 southeast Miami-Dade, and we audited 3 counties because of that fact. Those counties would have linear, and then you're looking at hospital capacity. That's that trend in huge jeopardy. But we watch it every day. See anything that big? We're all over. Doing is we're one on in Miami-Dade. There's still capacity here, which is good news. State, so I'll let Jared what we've distributed over 3 million masks. 5 masks. Jared ordered millions early March. She delivered, didn't go, and then this. So there's a lot of stuff on the second 3M through that. But I think at these hospitals, need for, as it surges, we've talked to, they do have now for this. We're very sensitive to the. One of the reasons I suspended the election, part of it was to have more room, and quite frankly, there we a lot to really, and Jared's been.
We're running all of the staging area up, the guard, the run. I mean, we didn't. Not I. I'm out of that. The president today now that 55 month of 3M over 3 months. They have changed their guidelines, allowing the K5 to be used in certain circumstances. Millions of surgical masks on order, and millions, and they're just coming in different. As they come in, they up, and we are from hospitals, first responders, and what's going on. Worth of POs that nothing can get. And that's not just it's happening all over the country. Consortium against each other. I mean, we are competing anybody but Antarctica for masks, and so at the division, it's our addition to getting these PPE. We know it's life-saving stuff. We're taking care of our heroes, our nurses, our hospital workers, everybody on front lines. Governor, thank you.
And I'm I'm in contact every day with the White House about PPE. I think correctly. Buy reimburse you. Really, what we've done. But I think the way has evolved. The federal needs your time at this point, so we're in constant. We would be able, we're N95 appropriate time. They are going. We're very transparent for handling things, where the numbers are going, and so they're monitoring that on a daily basis. I mean, obviously they've been doing that with ventilators. I think we've seen a change in demand for ventilators nationwide, but 95 very, very important. Okay. All right. Thank you. Let us know.
Do we have any radio? Any reporters here? All right, folks.